If you're thinking about trying to conceive and get pregnant, then one of the most empowering things that you can do is understand what's going on inside of your body. And fertility is more than just about timing ovulation. It's about overall health, hormone balance, and understanding your nutrient status. And with the right blood work, it can give you key insights into your overall health so you can feel confident and informed with your decision making. In this video, I'm going to break down the most useful blood tests, why they matter, and what they can tell you about your health and fertility. And please keep in mind, this blood work is not a requirement. It is just a very helpful tool that can help you make informed decisions about your health. And a lot of women don't realize that they have underlying imbalances that can be easily corrected by improving their diet, lifestyle, and potentially with supplements as well. So if you've ever felt in the dark about understanding your fertility, this is one way that you can take charge of your journey. I'm Mariah, and I help women take control of their PCOS and insulin resistance. With over 8 years of university education and a naturopathic medical degree, I've guided hundreds of women to take control of their health. And if you want more practical tips, make sure you hit that subscribe button. So let's dive into the main blood tests that can tell us a lot about your fertility and overall health. First, we're going to talk about the key hormones and how they impact your ovulation. The first hormone we're going to be talking about is progesterone. Progesterone should be tested 7 days after you ovulate. And by testing at this time, it helps to confirm that you actually did ovulate, and it lets us know if the progesterone levels are strong enough to support a healthy pregnancy. And then testing day 3 LH and FSH, so luteinizing hormone and follicular stimulating hormone. This gives us insight into ovarian reserve, egg quantities, and it can point towards hormonal imbalances such as PCOS. Prolactin is another hormone that we'll often test, as high levels of prolactin can impair ovulation. It can also make your cycles very irregular, and it can actually mimic PCOS symptoms. And another blood work marker that we can look at to assess ovarian reserve is called AMH, or anti-Müllerian hormone. And this is a blood work marker that gives us a rough understanding of what your ovarian reserve might be. And it looks at it comparatively to your age, because as we age, our ovarian reserve decreases, and in turn, that AMH level should decrease as well. And oftentimes in women with PCOS, they will often have high AMH levels because they don't ovulate as often. And so multiple follicles build up in that ovary, and that is what causes that AMH level to be higher. Next, we're going to talk about the thyroid gland. When we're looking into thyroid health, we often recommend doing a full thyroid panel, and that involves looking at TSH, which is the thyroid stimulating hormone, T3 and T4, which are the thyroid hormones. And we'll often look at thyroid antibodies such as anti-TPO. Having a well-functioning thyroid gland is very important for both hormone regulation, supporting implantation, and in preventing miscarriages. And there is research to show that even in healthy women who have fairly good functioning thyroid gland, if they have high thyroid antibodies, it seems to increase the risk of miscarriage. This is why it's very important to do a full thyroid panel so we can understand where the risk factors might be. Another blood marker that I often recommend getting tested is ferritin and your CBC with differential. So ferritin is a marker of iron storage, and it helps us to understand if you have adequate iron status going into a pregnancy. Because when you are pregnant, your body goes through its iron stores much more quickly than if you weren't pregnant. And then looking at that CBC and differential is looking at your red blood cells and your white blood cells, and it helps us to check for overall anemia. If you have signs of low iron, low B12 levels, or anything going on with your immune system, it will often show up in the CBC and differential. Next, I often recommend looking at specific nutrients. So that would be both vitamin D and B12. B12 is important for both reproductive health and with neurological development of the fetus and the baby. And vitamin D plays a role in both egg quality, hormone balance, and having adequate levels helps to reduce specific pregnancy risk. Another important thing with vitamin D is it's also good for improving insulin resistance. Next, it's good to understand what your baseline blood sugar regulation is like. So we'll look at HbA1c, and we'll often recommend looking at fasting insulin and fasting glucose. HbA1c gives us an understanding of what your blood sugar regulation has been like over the past 3 months or so. So HbA1c gives us a better insight into what your blood sugar regulation has been like over the longer term. And then looking at fasting insulin and fasting glucose, we'll often do a HOMA-IR equation, and that lets us know how much insulin resistance is present. And what a lot of people don't realize is, depending on the severity of insulin resistance, it can absolutely impact ovulation, and it can decrease egg quality and contribute to concerns with fertility. And another marker that's often looked at in terms of fertility and overall health is C-reactive protein, also known as CRP, and that is a non-specific inflammatory marker. And it's very important to assess how much inflammation inflammation might be in the body, as inflammation can impact implantation, when the sperm meets the egg, and other fertility consequences. And then, as I mentioned before in a previous video, timing of all of this blood work does matter. So we do want to test hormones on specific days in your cycle. So oftentimes we will look at LH, FSH, and estrogen on day 3 of your cycle, which is about day 3 of your period. And we always look at progesterone 7 days after you ovulate, which if you had a 28-day cycle and you ovulated on day 14, we'd be looking at your progesterone around day 21. And when it comes to testing your thyroid gland, we often recommend testing your thyroid earlier in the morning, so before 10 a.m., because your thyroid gland, that TSH, thyroid stimulating hormone, does fluctuate throughout the day. And then when it comes to testing blood sugar or cholesterol, it is often best to try and get that done fasted, so about 12 hours of fasting. And then we don't need to be as picky about when we're testing vitamin D, B12, and those other markers. And remember, this type of blood work is not a must do. It's simply a tool that can give you more clarity about your fertility journey. And please remember, if your levels are a little off, if they're too high, if they're too low, there are a lot of diet, lifestyle, and supplemental things that you can do to help improve these markers. So it's all about having a better understanding of your body and not fearing the blood work results. And if you are curious about your results, I do offer one-on-one fertility coaching. Check my website to learn more.